Sorry to interrupt. We'll get started. Thanks for all who are here today, joining us in person and on Zoom. My name is Lindsay, and I use she, her pronouns. I'm an Asian woman with pink round glasses, and I'm wearing a gray zip up today over my light blue scrubs. Today we'll be helping to facilitate this journal club held by the Medical Students for Disability Health and Advocacy Student Org, and we have live automated captions enabled, but please let us know if there's any issues. I'll be monitoring the chat, and then we'll save some time at the end for questions and discussion. But for now, I'll give it up to Grayson, our presenter today, to introduce himself and present on the Iazoni paper from 2021.
All right. Well, thanks everybody for coming. I appreciate it. Today I'm going to be talking about this paper from 2021, Physicians' Perceptions of People with Disability and Their Healthcare. So I just want to start with a little bit of background. Many of you probably know this number, but 61 million Americans, so about 18.4%, have some form of disability, and that number is expected to continue growing as the US population ages. In 1990, the Americans with Disability Act was enacted, which mandated non-discrimination against people with disabilities in healthcare facilities, physical and communication accessibility, and also the provision of reasonable accommodations and equal treatment. But despite this, unfortunately, healthcare disparities for people with disabilities remain pervasive, and their sources can be broken up into systems and patient levels. So I wanted to quickly start by discussing some of the systems levels disparities. So the first of these is inadequate provider training. As many of you guys have probably started to realize, we don't really get that much formal education on disability-related topics. And obviously down the line, that manifests as just an inability to provide the same quality of care to people with disabilities. The second thing is ineffective communication accommodations for people, for example, with severe hearing loss in healthcare clinics. An inability to provide accommodations to amend that are going to lead to some real breakdowns in care. And that's a persistent issue as well. And then the last thing, and probably the most obvious one for a lot of people, are physical access barriers. Inaccessible clinics are a huge barrier for various types of care in hospitals, clinics, and other settings. And then quickly on the patient side of things, people with disabilities tend to have a higher rate of complex comorbidities in addition to their disability, and this complicates care. And people with disabilities tend to be disadvantaged in many aspects of the social determinants of health. So for example, they're less likely to be employed, more likely to be of low socioeconomic status, and we're all well aware of how those things can lead to suboptimal care outcomes at this point. And then there's one thing that the paper didn't mention that I think was important to bring up, was that the mandates of the Americans with Disability Act are pretty infrequently enforced. So many clinics you'll go to, you'll see glaring issues in terms of they're not abiding by the ADA. But these things really aren't enforced until patients with disabilities start to advocate for themselves, and that's often an uphill battle. So that's another reason. One potential cause of these healthcare disparities that really hadn't received much attention prior to this study are the attitudes of physicians in regards to disability and whether physicians have implicit or explicit biases in regards to people with disabilities. But this is obviously a really important factor to consider, especially given, first of all, the pervasive societal stigmatization of disability throughout human history and in today's society. And secondly, previous studies, specifically this systematic review, have showed that implicit biases in racial and ethnic domains amongst physicians significantly alter treatment decisions, patient outcomes, and other aspects of care. So it's not really an unreasonable assumption then that if physicians were to hold similar assumptions and biases about people with disabilities, that this could negatively impact treatment outcomes as well. So to investigate this question, these researchers devised a survey broken up into several different domains. Ultimately, it was 75 questions grouped into 8 modules. The first 5 modules addressed specific disability types. And the next module talked about physicians' responsibilities under the Americans with Disabilities Act, just to assess how well physicians were aware of their responsibilities. They asked about physicians' views about people with disabilities and also the quality of care that these physicians felt they were providing to these patients. There was another module that just asked about the characteristics of the physicians' practices, so whether they were private or in academic centers, how many physicians practiced there, how many patients they saw each week, and things of that nature. And then the last module was just to collect demographic information about the physicians. Some more criteria that they used to select their sample. They were only looking at physicians treating adult patients, so there was no pediatric patients here. And they looked at 7 specialties. So they looked at family medicine, general internal medicine, rheumatology, neurology, ophthalmology, orthopedic surgery, and OB-GYN. And the reason they looked at the first 6 of these specialties is that they're more likely, or physicians in these specific specialties are more likely to see a high proportion of individuals with disabilities. And the reason they looked at OB-GYN was because previous studies have shown high rates of physical access barriers in OB-GYN practices. So they felt that these were the most relevant specialties to take a look at for this study. And just to note, they excluded any physicians who were practicing at VA hospitals, all trainees, so no residents are included in this study, locum tenens physicians, and also hospitalists. Okay, so how they went about recruiting is they actually used a commercial database to identify all board certified US physicians in these specialties who met the criteria. And they mailed these surveys with a $50 cash honorarium up front. So ultimately, they reached out to a pretty large number of physicians in each specialty and received response rates of right around 60% for each specialty for a final sample size of 714 physicians. So getting into the results here, hopefully that's big enough for you to see. I think it is. Just a few things I wanted to highlight about the sample characteristics before we look at some of the results. First of all, the sample was 62.8% male. This is just something to keep in mind because it's a pretty significant lean towards male physicians. So just something to keep in the back of your mind as you're interpreting the rest of the results. 64.5% of the physicians surveyed were white as well. So again, a pretty significant lean there, and just something to keep in the back of your mind as you're interpreting the results. And lastly, the majority of physicians, 61.7%, were in private practice. So again, just something to consider. Okay, so I wanted to break up the key results presented in the paper into 2 categories. First of all, I wanted to talk about perceptions of physicians of people with disability and their care. So first of all, 79.8% strongly agreed that understanding their patients with disability is very valuable. 18.1% strongly agreed that patients with disability are often treated unfairly in the healthcare system. 82.4% of participants reported that people with significant disability have worse quality of life than people without disability. And 40.7% were very confident about being able to provide the same quality of care to disabled patients. So I think on the face of it, these results aren't that startling, but I think it's better to think about sort of the inverse of these findings. So for example, if 80% of physicians strongly agree that understanding patients with disabilities is very valuable, that means that almost 1 in 5 don't feel that having this understanding is very valuable. And if only 40% of physicians are very confident in their ability to provide the same quality of care to disabled patients, that means a full 60% lack complete confidence in their ability to provide the highest standard of care to patients with disabilities. And that seems like a much more troubling finding. So the next category I wanted to talk about was welcoming patients with disabilities into practices. And the researchers found that 56.5% of participants strongly agreed that they welcome patients with disability into their practice. And again, that the inverse of that means that about 45% of physicians do not strongly agree that they welcome patients with disability into their practices. That's a huge number. So just a couple of further analyses that they did. They wanted to look at which groups of physicians were less likely to strongly welcome individuals with disabilities into their practices. So the first group that they found were male physicians. Male physicians were significantly less likely to strongly welcome patients with disabilities into their practices. Physicians who had been serving for longer, I think they broke it up into serving for less than 20 years versus more than 20 years. And physicians who had been serving patients for more than 20 years were also less likely to welcome patients with disabilities into their practice. Physicians in private settings were less likely. And physicians who didn't report highly valuing understanding patients with disabilities were somewhat unsurprisingly also less likely to strongly welcome patients with disabilities into their practices. And then the last group that they looked at here were physicians who didn't report being very confident in their ability to provide the same quality of care were also less likely to then welcome patients with disabilities into their practice. So the implications of this study are pretty alarming. For 18.4% of the US population, which is those who have disabilities, there's a roughly 50% chance that they won't be strongly welcomed into a medical practice by physicians. So the other thing I really wanted to highlight were that 4/5 of physicians surveyed reported that people with significant disability have a worse quality of life than people without disability. This is a really pervasive assumption among physicians, as you've seen here, but also among non-physicians, that people with disabilities have a worse quality of life than those without. But studies have shown this to be a pretty mistaken assumption, and that individuals with disabilities report really similar qualities of life to those without. And it's pretty easy to see how this assumption among physicians that people with disabilities have a lower quality of life could lead to differential treatment of individuals with disabilities. In the early stages of the pandemic, for example, several states drafted triage policies that recommend disability-based exclusion from life-saving treatments. And this is a move that's pretty clearly supported by the mistaken assumption about diminished quality of life among people with disabilities. And the other finding here that I really wanted to highlight were that only 2/5 of physicians reported feeling very confident in their ability to provide the same quality of care to people with disability. Um, and like I mentioned earlier, this is somewhat unsurprising given the lack of direct training we receive in this domain. And it's something that we'd like to work on as a group, just increasing these opportunities. Um, so one finding that the researchers didn't really expect was that so few physicians reported strongly welcoming individuals with disability into their practice. So they kind of spent a little bit of time discussing potential reasons for this. And they noted that the strongest predictive variable in explaining a physician's likelihood of strongly welcoming patients with disabilities into their practice was how confident they reported being in providing a high quality of care. So there's a direct relationship to how much knowledge that you feel you have, and then how likely you are to then welcome those types of patients into your practice. So that then led the authors into a discussion of a pervasive problem that I mentioned several times now, that medical schools generally include very few formal disability topics into their curriculum. And then lastly, they just discussed some potential implications of these biases among physicians. Um, so there was a couple of examples that I wanted to highlight here that seem to indicate some potential implications of these biases. And the quote that I pulled from the paper was that qualitative research studies involving interviews with people with disability suggest that physicians often make erroneous assumptions about patients' values and preferences, limiting their healthcare options and compromising quality of care. So one example that they discussed were failures to provide PAP tests to women with disability or discuss contraception options because of their incorrect assumption that women with disabilities are neither sexually active nor at any risk for unintended pregnancy. And this is a pretty well-cited example at this point. Another example was that physicians often assume that women with disability who are newly diagnosed with early stage breast cancer prefer mastectomy to breast conserving surgery under the inaccurate presumption that these women care less about preserving their bodily appearance. And then the last example they brought up was that physicians often believe that they have superior technical knowledge about disabling conditions, but they can and often are wrong and take actions that harm patients. And an example they use is that physicians often incorrectly believe that all patients with spinal cord injuries can't feel pain below the level of their injury, and therefore refuse to provide pain relief to these patients during procedures below that level. Okay, so some discussion questions that I put together. We don't necessarily have to use these direct ones. If there's anything people want to discuss more directly, we can use those instead, but just some questions that I wrote down here. What are some other ways that internalized biases and assumptions about patients with disabilities might impact care or contribute to disparities? What factors might be contributing to the maintenance of these biases despite the increasing attention to healthcare disparities? How might we as medical students contribute to the correction of these biases? And lastly, how can we reach longer serving physicians who may have been educated when stigmatization of disability was more explicit? And like I said, we can go off these or we can just kind of go with whatever questions or thoughts that you guys might have. Yeah.
Quick thank Grayson for this great presentation. We will stop the recording here for our online audience. And if we ever disseminate this, so this discussion will remain confidential for us.